Joining me now from Syracuse, New York is David Larsen. He's an associate professor at Syracuse University and specializes in global health. David, let me just start by asking about masks. I mean, I have friends in China who just think we're bonkers in the West for not wearing them. Just about everybody there does. As Jack pointed out, in Asia, it's very common. Now there's this debate, the CDC kind of sort of in favor of it, but, you know, Americans aren't used to that. Well, what are your thoughts on this?
Well, the U.S. CDC doesn't recommend it right now. The Chinese CDC does. And there's evidence to suggest that it may be protective. The CDC will cite a lack of available evidence, and what that means is there's no randomized studies that have shown that when a whole community wears a mask, you see decreased transmission of a respiratory illness. But we should be wearing masks, in my opinion. We should take the playbook that China, South Korea, and Japan have used and apply that here as much as we can.
You talked about that playbook in a tweet recently. You said Southeast Asia has seen 3 coronavirus epidemics in the last 20 years. They minimize mortality through all of them. What are they doing that we can implement here in the U.S.? So what are they doing that we should be doing here?
So they're doing the social distancing, and that's good that we've implemented that. But then they also have this culture of mask wearing, and I think that could be implemented here. So we need to scale up our homemade mask production so we can get more masks in the population.
The White House is saying today we may see 100 to 240,000 deaths, and that's with the mitigation that we've been hearing about. And yet, you talked about what happens in Asia. Here in the United States, it's kind of a patchwork. I mean, you see some governors who are very aggressive, others who are not. Tate Reeves in Mississippi doesn't want to close down the restaurants and the bars, and he says we're never going to be like China. Do you think those numbers are kind of, I mean, how do you see these numbers breaking out? I mean, it could be much worse than that, don't you think?
I think if we don't practice the social distancing and we don't do what we can, it could be worse than that. I'm hopeful that we can keep the numbers low, the mortalities low. And that's up to us as citizens to stay the course with social distancing.
Speaking of masks, the Texas Tribune has a story out there. Hatfield & Company, a firm, put up for sale masks with the asking price 6 times higher than the usual cost. The Attorney General of Michigan also saying a company there was trying to sell 10 packs of N95 face masks for nearly $100 a piece. They usually go for about $1.40 a piece. What about what we're seeing out there in terms of the markups and that sort of thing? The fact that some of these doctors, nurses can't even get their hands on these masks.
Yeah, it's disappointing to see that, the markups and the prices. But we need to be sure that we save the best masks for the doctors. The doctors and the nurses, they're at really high risk from this coronavirus. We're seeing high mortalities in health workers in other countries. And when we see doctors pass away from this virus, then we're losing good people, and we're losing the ability to care for each other. And so we need to save the N95s and the Met surgical mask. And I'm a big proponent of homemade cloth masks.
What about the federal response to all of this? We heard from the governor of California just a couple of days ago. He said that they got about 170 broken ventilators from the federal government. They had a company in California which was able to fix them. More recently, Illinois pleaded for N95 masks, was told they would get about 300,000. The Fed sent the wrong masks. The governor says the shipment was smaller than the previous shipments. We see a lot of news conferences, but should the federal government be doing more?
It's hard to tell. It's hard to understand what exactly the federal government is doing and the states are doing themselves. I think it would be good to have a positive message and unity from the federal government. What I see right now is a lot of divisiveness and a lot of finger pointing, but it would be great to have a leader stand up and unite us.
David Larsen joining us from Syracuse University. Thanks so much.
Yeah, thank you.